Artificial Intelligence Dr. www.abcpharma.net/English. User question: are there any specific biomarkers or novel blood tests on the horizon that could potentially improve the diagnosis, monitoring, or management of patients with an Aveir VR leadless pacemaker? Claude AI answer: while there are currently no specific biomarkers or novel blood tests routinely used for the diagnosis, monitoring, or management of patients with an Aveir VR leadless pacemaker, ongoing research is exploring potential biomarkers and innovative diagnostic tools that could improve patient care in the future. Here are some areas of interest. 1. Biomarkers of cardiac remodeling. Researchers are investigating various biomarkers that could help assess cardiac remodeling in patients with pacemakers, such as natriuretic peptides, e.g., BNP, NT-proBNP, galectin-3, and soluble ST2. These biomarkers have shown promise in predicting the development of pacing-induced cardiomyopathy and heart failure in patients with traditional pacemakers, and they may also be applicable to patients with leadless pacemakers like the Aveir VR. Monitoring these biomarkers could potentially help identify patients at higher risk of adverse cardiac events and guide preventive interventions or closer follow-up. 2. Inflammatory and oxidative stress markers. Inflammatory and oxidative stress markers, such as high-sensitivity C-reactive protein, hsCRP, interleukin-6, IL-6, and myeloperoxidase, MPO, have been associated with adverse cardiovascular events and may play a role in the pathogenesis of pacemaker-related complications. Assessing these markers could potentially help identify patients at higher risk of device-related infections, lead dislodgement, or other inflammatory-mediated complications, allowing for earlier intervention and improved outcomes. 3. MicroRNAs, mRNAs. MicroRNAs are small, non-coding RNA molecules that regulate gene expression and have emerged as potential biomarkers in various cardiovascular diseases. Specific mRNA profiles have been associated with cardiac remodeling, fibrosis, and arrhythmias, and they may also have relevance in patients with pacemakers, including the Aveir VR. Monitoring circulating mRNAs could potentially provide insights into the patient's cardiovascular health, pacemaker response, and long-term outcomes. 4. Novel imaging techniques. Although not blood tests per se, novel imaging techniques, such as speckle tracking echocardiography and cardiac magnetic resonance imaging, MRI, with specialized protocols, are being explored to assess cardiac function and pacemaker-induced remodeling in patients with leadless pacemakers. These advanced imaging modalities could complement blood-based biomarkers in providing a more comprehensive assessment of the patient's cardiovascular status and guiding personalized management strategies. It is important to note that the development and validation of novel biomarkers and diagnostic tools for patients with leadless pacemakers like the Aveir VR are still in the early stages of research. Further studies are needed to establish their clinical utility, cost-effectiveness, and integration into routine practice. In the meantime, healthcare providers should continue to rely on established blood tests, such as complete blood count, electrolyte panel, and markers of renal and hepatic function, along with regular pacemaker interrogations and clinical assessments, to monitor and manage patients with Aveir VR leadless pacemakers. As new evidence emerges, the role of specific biomarkers and innovative diagnostic tools in the care of these patients will become clearer, potentially leading to improved patient outcomes and personalized management strategies.